full. It should be a full movement, 4, 7 times. 4, 7 times. It should just be a normal pace movement. It doesn't necessarily have to be fast. 3, 4, 5. Nahihilo ka ba? Meron bang numbers sa mukha? Nakipilo ba sa mukha? Kaya lang? Okay. After which, the patient should be standing in front of you, and then you ask your patient to look at the bridge of your nose while you scrutinize the eyeball movement. Look at the bridge of my nose. Any numbers of the face? Do you feel nauseous? Alright. We would be asking him to stand up. If he's performing in a standing position, my left upper extremity, my left forearm is at the back of his trunk. My left hand is on his parieto-temporal area. My right hand is on the temporal area. I'll make sure that my left forearm will restrict trunk movement because I only want movement from the neck up. Look at the bridge of my nose. And then you check for the unnecessary movement. This sustained rotation, this rotation I mean is sustained for 10 seconds. This rotation is sustained for 10 seconds. After which, you ask the patient to maintain the head in the neutral position for 10 seconds. Okay? During those times, you have to ask those symptoms. Okay? This is for 10 seconds. Bakit kailangan, why is there a need to provide for a rest period? Because some patients will have latent responses. Okay? After the reading, some patients will complain of, I feel dizzy, I feel unsteady, I feel that I want to vomit. That's also considered positive. Clear? After testing for this side, you test for the contralateral side. Sustained rotation for 10 seconds and then 10 seconds rest. During those times, again, you monitor for those signs and symptoms. Is that clear? For us, PT, only one symptom or a sign will indicate for what? Deferment of treatment. Hindi yung symptom patient doon. Okay? We ask for the doctor go signal or clearance for us to fix the patient. Okay? Aluwanan? Next, for test 2 part 1, this is test 2 part 1. Diba? Test 1 part 1 is this. Test 2 part 1 is this one. Alright. Under test 2 part 1 is the differentiation test. Remember that when you rotate the head towards your side and there is positivity of symptoms, then there are two systems that may be incriminated or that may cause the symptoms. The first system is the vestibular system, which is found in the middle ear. And the second system is the vertebral artery. Anyone here? The vestibular apparatus is in the middle ear, and then you have the vertebral artery running to your cervical spine. Anyone? Now, if I want to further confirm that it's the vertebral artery that causes the symptoms, then I have to do this differentiation test. How is this done? I'll hold the head steadily at the neutral position. I'll ask him to be steady on his feet, secretly planted on the ground. And then you face the left side using your thumb. Twist your thumb to your right. Sorry, to your left. Twist your thumb to your left. And maintain your head. You look at the bridge of my nose. That's it. And then maintain it for 10 seconds. Again, you look for any start move. Cute. Now, no shoot? Okay. Now, kung positive sa dito, then that means it's the vertebral artery system that causes the symptom. because the head is already in a steady position. Remember that the vestibular apparatus is only excited when there is head movement. Right? So this differentiation test will further intimidate the vertebral artery. Is that clear? Now, if your patient's symptoms come out secondary to head movement, then that is the time you proceed to part 2 of this VBI test. If head position of the symptoms of the subject, then you proceed to part 2 of the test. Part 2 of the test is performed with the patient in a sitting position. The patient is in a sitting position with the trunk erect, and then I use the same hand placement. Look at the bridge of my nose. This is a sustained rotation for 10 seconds. Muscle. There's no unnecessary eyeball movement. Long here. 10 seconds. And then 10 seconds to relax. Look at the bridge of my nose. And then same one. So after which you go to the other side. Is that clear? Next, test 2 of part 2. If this is negative, you proceed to test 2 of part 2. How is that done? Neck rotation plus extension. Look at the vision window. Alright? For test 3, if this proves negative, you proceed to test 3 of part 2. Probably you could ask your patient to sit on a low chair or the monoblock chair. Test 3 of part 2 entails neck extension. Have to be very careful. If toes slam the head towards extension, at hindi pwedeng nagkamali dyan. So you have to be very careful. So, slowly move the head towards extension. My left forearm is guarding the movement. And then my right hand would assist for the movement. See that thing? Don't ask your patient to recline. Straight body. You look at the ceiling. Look at the ceiling. Maintain. Come here. And then relax. Alright? When you have to do the test 1 of part 3, you could proceed to test 1 of part 3. How is it done? This is very critical. Part 3 or any test or the VBI test done with supine position is very critical. Since the movement, the control of movement comes from the therapist and not from the patient. Okay? Part 1 and part 2 can be considerably controlled by the patient since those are performed in a standing and in a sitting position. But part 3 is solely controlled by the therapist. Okay? And remember that in part 3, the patient's head should be relaxed. Okay? In part 3, the neck movements are brought into its extreme range at the end range. Usually the neck movement is greater in a supine position compared to a sitting position. Okay? Still the same. Test 1 will entail neck rotation, test 2 neck rotation and extension, test 3 and then you request the eyeball movement. You use layman's term. You use the layman's term.
Is your face flipping out right now?
Rotation with extension. Okay. Next, the last one, test of part 3 is you put the neck into extreme extension.
Parang sleeping din, pero sa side.
Kairos, they need to consider 3 or 4 symptoms out of those 7 before they refer the patient. But for physical therapy, only one would need clearance from the doctor before you could proceed with the test, or before you could proceed with the test. Alright? That's for BBI. Next, we proceed to